Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for our weekly press conference on Delaware's response to COVID-19. We have a number of updates for you as we move into Thanksgiving week. This is a really big week for all of us. It's a really big week in terms of our response to COVID-19 as families gather, as college students come back home, as college students move on from the University of Delaware, Delaware State University, and Wesley College and go back home. We've been doing an incredible amount of testing, AJ, and I know you're going to report on that, both on the college and university campuses and across the communities. The numbers that you've reached are really extraordinary, and your team, and our partners at Walgreens, Newcastle County, all the churches and schools that have been part of that testing effort need to be thanked, and we show our appreciation. We'll talk a little bit about what that means. We know generally that it means that if you test negative, it's just an indication of that day that you might be that you are negative, but you could have been exposed a couple of days before and turn out positive after that. And so we need to talk a little bit about how you should react to that and what level of confidence that you should have in that positive test. But it is a good thing that people are tested, so we know what the spread of the virus is here in our state. We do know that it's getting worse. The number of positive cases on a daily basis has continued to climb. And importantly, the number of hospitalizations, as we'll see in a minute, has continued to trend upward, and that's a very serious concern. We'll talk about that in the context of what we experienced last spring, the low point this summer, where things were looking really good in our state. And I think we all anticipated moving back indoors with the colder weather that we would see an outbreak, and we're seeing it here in Delaware and in states around us, in New Jersey and Pennsylvania and Maryland. Obviously, that has effects on our own state with people who cross the border all the time. Good news this week, governors, the National Governors Association, our executive committee, met with the President-elect, our own Joe Biden, and the Vice President-elect to talk about the state's response to COVID-19. It's a very positive meeting. Those of us who know the President-elect know Joe as well as we do, and know that his focus is on making sure that he and his team are addressing this issue from a science-based perspective, that they're cognizant of the concerns of individuals and families at the kitchen table, and that he sees the states, the governors in particular, who've been on the field battling this virus since back in March, are a true partner with the federal government. The governors, Democrat and Republican, from Republican governors Baker and Hogan, Baker in Massachusetts and Hogan in Maryland, to Democratic governors Cuomo and others I was asked to join, obviously, as the President-elect's hometown governor. We're kind of unified in our message that what we needed from the federal government was leadership and setting the example. From the President's, from the Oval Office, support, particularly financial support for states as we move into this second surge across the country, the extension, if you will, of the CARES Act resources that were made available months ago, but that expire at the end of the year. Democrat and Republican governors have that as their highest priority, the support that we need for personal protective equipment and the national stockpile. And we had a lot of discussion about the vaccine. There are now 3 vaccines that are nearing final approval, 2 that are coming down the home stretch. Dr. Rattay will talk a little bit about that. That's really good news. There's light at the end of the tunnel. And what it says to us as we move into this very challenging time over the Thanksgiving holiday, we really need to lean into making sure that people are wearing masks, they're being socially distant, they're being careful in gatherings. It's really easy to slip a little bit and let your guard down, not wear a mask when you're in having a Thanksgiving celebration. But we're advising push off that celebration with multiple households. If you're there with your immediate household and family, that's the best way to prevent the spread, as opposed to bringing in cousins and the young people who are away working in other states or in college, that type of thing. And for me, it's really an exercise in protecting my 89-year-old mother, who's very healthy, by the way, but certainly at risk. And we're creating a Thanksgiving celebration that will help hopefully keep people separate and protect my grandmother and my mother. We all ought to think about that as you move into your plans. We do know, we'll talk about it, that Delawareans are not traveling out of state, but that may mean that they're traveling to friends and relatives here in Delaware, and the risks that they're involved with all of that. So the watchword for us is we've got help on the way. In terms of our president-elect, we've got help on the way. In terms of the vaccine, it's really just the expectation, Dr. Rattay will run through some of that, is that some of those vaccines will arrive here in Delaware early in December, within 24 hours of the final approval, as we heard on the White House task force call this past week. So some good news, some concerning messages. You know, our restrictions that went into effect yesterday, tightening restrictions as we moved into the Thanksgiving holiday, are really meant to try to prevent continuing spread of the virus here in our state. And we're seeing it in every demographic and every really corner of our state. And so everybody needs to be very cautious about what they're doing. So let's go to the slides. Let's go to the dashboard. 32,000, almost 33,000 total positive cases of COVID-19 in the state of Delaware since our first case back in March. Our fatalities continue to rise at 757. And here's the really concerning fact that we're seeing 185 hospitalizations in Delaware, which is about 10 above what it was as we gathered last week, and we'll put it in the context in a minute or two of the last 9 months. So the cases by county, in Newcastle County, we have 18,000 positive cases. In Kent County, 4,500, and then in Sussex County, again, where we have the greatest percentage of number of positive cases per the population, almost 10,000. Our percent positive of persons, we've talked about the change of calculation of our percent positive from a person's tested to the number of tests administered. We're just a little bit above that 5% threshold, which is the World Health Organization target to be below that. Earlier this summer, we were in the low 4% range, and of course we want to head back in that direction. So on a 7-day moving average, you really have to look at the 7-day moving average now on each of these criteria, because we're doing so much testing and we get big batches that come in on a given day. And so it could, if you just look at the daily positives, it could scare you a little bit or make you feel better than you should. So the 7-day moving average is at 440. Again, that's 4 times what it was back in the end of August, early September, when we were on again, off again, the quarantine list from New Jersey, New York, and Connecticut. Just as a benchmark to think about the current number of cases at 440. The total number of tests that we've done and the number of tests administered, you can see we've done almost 700,000 total tests administered to 406,000 Delawareans. So many people have been tested more than once. I just was tested over the weekend for, I guess, the 4th or 5th time with my sons coming back home and they got tested as well. And then we'll talk a little bit about the comfort level or not that gives you when you gather with friends and family. You should not let your guard down, even though you test positive one day for lots of different reasons. All the demographic groups are spiking up, as you can see, led by the young adult crowd, 18 to 34-year-olds, still at the highest infection rate there. And so as we move on to see our 14-day view of the data dashboard, the first top level, far left is the very concerning one as the hospitalizations continues to trend in the wrong direction up to a high of 185 today or yesterday. And you can see in the middle that the number of new hospitalizations on a day-to-day basis goes up and down. Not too instructive, although it will show you a little bit of a trend as the new hospitalizations occur that way. New positive cases there on the far right, again, continuing to rise in the 400 to 500 range. The percentage of persons who are tested positive at a 7-day moving average around 14%, and then the percentage of the tests that are positive, the bottom row, middle, is just ticking around above and below 5%. The next graph just shows you the peak back in March, April. So here's the 90-day view, and you can see very clearly from our low levels of hospitalizations and new hospital admissions, new positive cases, percent positive of persons tested positive, and to a lesser extent, the tests that are positive. You can see that increase in all of those when you look back over 90 days. We want to peak now and start heading in the right direction, and the way to do that is to avoid coming in contact, increasing the probability of catching the virus by limiting the number of contacts you have with people who may be positive. On the data dashboard for protective equipment, all the vessels are filled, as you could see, so we must have gotten those gloves in a couple weeks back. So we talked about hospitalizations. Just a reminder there, first of all, that number is as high as it's been in months at 185, higher than it's been since the peak at 337, and it's a lagging indicator. So people get infected, then they get sick. Those infections show up in higher case numbers, then they get sick, and then they need to be sent to the hospital, and they show up sometime after they've tested positive or come down with the virus in the hospital, and ultimately possibly in the critical care unit or in the need of a ventilator. And so much of our efforts and efforts in states across the country is to prevent that critical care capacity in our hospitals. We were able to do that back in the spring as we peaked on April the 17th at 337. You could see this really well, both the trajectory of the virus starting in March, ticking up to its peak in the end of April. This is hospitalizations. On April the 10th, we were at 181, so about where we are today. A week later, because of that lagging indicator, we had peaked up at 337, which was the high point overall. We're still in good condition there with availability of critical care beds. We estimate, AJ, I think, between 400 and 500, depending on the day. AJ's shaking his head. And so at 337, we're getting close to that, but we're still under the level that's available, in the hospitals up and down our state. So as we got healthier through June, July, and August, we reached a low in hospitalizations of 29. So we went from 337 all the way down to 29. And since then, and particularly over the last month, we've ticked up from about 50 hospitalizations in the beginning of September to 185 now as of November the 23rd. We don't want to go from 185 to 337, although the possibility exists out there even with the people that are infected already. And we saw back in the spring, we went from 181 to 337. And so we need to really lean into all the protective measures that we talked about to protect that hospital capacity, the surge capacity, which we know is in the 400 to 500 range depending on the day. And we also know that hospitals are continuing to do elective procedures, and so there's more going on in the hospitals that needs to occur. They've seen increased acuity, seriousness of conditions, heart conditions, stroke, those kinds of things as a result of patients who kind of pushed off their care because of a concern about COVID-19 in hospital settings because of the fact that they weren't doing certain testing to identify early onset of cancer and the like. And so hospitals are doing those procedures now. They're encouraging Delawareans to come in and get that work if they need it done so that they don't have a more serious problem down the road. Well, that means that there comes a time where they may have to curtail some of that activity because of the surge in COVID-19 cases. On the positive side, I don't think, Dr. Rattay, we've seen as many hospitalizations as a result of the flu yet this year, probably because people are wearing masks and being much more protective from an infectious disease perspective. But we need to protect hospital capacity through this winter, and everybody has a hand in that. Whether you're part of a vulnerable population or not, if you're wearing your mask, you're helping protect the vulnerable populations who may end up compromised and with COVID-19 and ultimately in the hospital. One of the good things that we're seeing, there was a AAA Mid-Atlantic survey of residents of Delaware, Pennsylvania, and Maryland, so the states in our region, and each of our states, including Delaware, where 86% of the residents said they don't plan to travel for Thanksgiving. And that's a good thing because they're not going to be hopefully mixing with others that may increase the probability of being exposed to COVID-19. It's not going to be a good thing if we end up staying home and then going for Thanksgiving a meal or celebration with multiple households, somebody in that gathering who's COVID-19 positive and then infects others. And so we need to be careful. We're already being careful and not traveling. And the numbers were similar in Maryland and Pennsylvania, meaning in our region, people are kind of staying at home, being careful, seeing the increase in positive cases in all of our states, and knowing that we've got help on the way, light at the end of the tunnel with the vaccine coming. And we don't want to close our economies down anymore. Already we've increased the restrictions. We want to keep our children in school, those that are in, and we don't want to send children back to remote learning. So we need to lean into it by not having big Thanksgiving dinners with lots of family and friends, multiple households, doing it virtually. Everybody decide they're going to prepare a particular part of the menu and then send it around and visit via Zoom or not be in person. And certainly when you're there, be outside if you can. I looked at the weather forecast, supposed to be maybe a little rain, but not too cold. So opportunities to help. So we need everybody to pitch in. We know that the Thanksgiving, particularly the Friday after Thanksgiving, tends to be a big day for bars and restaurants for young people in our state. We have increased restrictions on bars and restaurants, only 2 people sitting at the bar, 30% capacity in restaurants compared to 60% a week and more past, mask, seating distances. But we're going to have zero tolerance for establishments that are out of compliance. I've been advised that Pennsylvania is closing down those venues, which means that there may be other people coming to our state for this kind of activity, don't come to Delaware. That's our message to those in Pennsylvania who can't go to restaurants and bars in their state. Don't come to Delaware to drink. We always have increased DUI patrols in our state over the holidays. They will be there again this weekend, particularly in the border area around Pennsylvania and throughout the state as they normally do. So the message is for your Thanksgiving holidays is enjoy the time off, enjoy your interaction with family, keep your gatherings small, limit the number of households, wear a mask, keep your distance, have virtual get-togethers when possible, and give thanks for all our blessings, including the fact that we have a vaccine coming, that there's help on the way, that our own Joe Biden will be the next president of the United States and will be a great partner for all of us governors in every state across the country, Democrat and Republican, as we continue to address COVID-19. One other piece of good news before turning it over to Dr. Rattay. We have been doing a lot of work with the CARES Act relief and support, and we have decided to use $45 million of CARES Act funding to support our institutions of higher education here in Delaware. We've been talking about that for several weeks now. They've lost considerable revenue as students were not on campus. Their enrollments were down, and so this will give them, these resources will go to the effects of COVID-19, have to be used for those purposes and have to be spent by the end of the year. I understand that congratulations are appropriate for our own Dr. Rattay, who was awarded the Medical Society of Delaware's President's Award recently. We couldn't have a better recipient this year at a time of COVID-19 pandemic. You've heard me say before that when I was first elected lieutenant governor, I asked the new director of the Division of Public Health what her biggest concern was. And she said that her biggest concern was the return of a flu pandemic. Well, we haven't had a flu pandemic, but we certainly have had a pandemic, and it's obviously a big concern, and Dr. Rattay has led us all through this with a steady hand, always being thoughtful, notwithstanding the pressure coming from other sector, and certainly deserves to be recognized with the Medical Society of Delaware's President's Award. If I had a big trophy, I'd hand it to her right now, but since we're under COVID-19 restrictions, we can't do that, at least not without appropriate social distancing and a mask on. Dr. Rattay, congratulations, and we're interested in hearing what you have to say as we move into this all-important Thanksgiving holiday weekend.
Thank you so much, Governor. I wanted to begin today with sharing some sobering thoughts that I had earlier this morning. I was looking at our data, and I looked back over the past month and realized that we have lost 52 Delawareans just in the last month. And several times in the last week, I've heard people continue to compare this pandemic to the flu and the mortality rate to the flu. Well, the worst flu season that we've had on recorded season in recorded history here, we had 36 deaths in the entire season. And as you saw today, we have, I think it's 757 deaths in Delaware, but 52 in the last month. And as we know, it's a lagging indicator, and we've seen our cases increase so dramatically in the last 2 weeks. Unfortunately, we have every reason to believe that that number is going to go up. And so we know that this pandemic is a nuisance to most people. It's having impacts on us in many ways. But I I also want to remind people that the impact of this is tragic in the loss of lives of so many in our state. As you can tell, I spend a lot of time with our data, and as I was a couple days ago looking at how the past week went, using the same methods that I've been using for the last couple of months, our entire state, except for one zip code, would have been highlighted in blue when we look at our areas of concern this week. So really, the entire state of Delaware has increased our case rates and our positivity to the degree where we would consider pretty much every zip code an area of concern at this point. So I wanted us, though, to continue to be able to look at the areas where we do have even higher levels of concern. And so I did change the thresholds, and these are now the zip codes that are highlighted as even more significant areas of concern in our state. So we have seen about a 40% increase in cases in Newcastle County this past week. So that's the county where we have the highest increases. Wilmington, Newcastle, Bear, Middletown, and the Newark area, as well as Claymont, all are showing higher levels of spread. Also in Kent County, we have Hartley, and then downstate, Milford, Lincoln, Ellendale, Bridgeville, Laurel, and Delmar have the highest case rates and percent positivity. So again, these are the areas where we're seeing more spread, but really the spread is throughout the state. So there is no area in our state right now where we can say we aren't concerned. So I'm going to do a very quick testing update because I wanted to touch on a couple of things. One is clearly we've seen a significant increase in testing over the last month. AJ has a great slide that he's going to share. But in the last week, we've had between 2,000 and 11,000 tests done daily. On November 18th, we had over 11,000 tests done. So a tremendous amount of testing done. I want to give AJ an enormous shout out. We have so many different options for testing, and people are taking advantage of the tests. But even with all of the testing that is available right now, we know that lines have gotten longer. People have become frustrated. And so we really want to encourage patients. We want to encourage people to pre-register because that can certainly shorten the time. But I just want to acknowledge that there is a lot of testing. I did see from a CDC report we got last night that we're in the top 5 of states for testing. So we really are doing a lot of testing in comparison to other states. Of course, that is leading to what's an important public health strategy of identifying cases, so then those cases can be isolated, we can find contacts, and have contacts be in quarantine. However, because the cases have increased by so much, and each case now has more contacts, the length of time between our system finding out about positives and cases being contacted and contacts being contacted has also lengthened. So we have a number of strategies in place to address that, and that should be improving very quickly. But again, we just want people to be patient and to recognize that things are taking a little longer right now. The case investigations are the most important, so we want to be able to talk to every case. If you know that you're a contact, maybe because the app has told you so, or you know that you were close to somebody who became a positive, make sure that you go ahead and quarantine. The instructions are in the COVID DE alert app, so it's pretty easy to know what you need to do if you need to be in quarantine. But again, we just want everyone to practice patience while we go through these high levels. Also wanted to provide an update. Walgreens has been a tremendous partner for us. You know, all the increase in testing has made their normal operations a bit more challenging. So as of this Friday, November 27th, they're going to transition to a registration-based system only. They'll be able to test about 45 per site per day, but they're also adding in December 1st, 5 new sites, so Delmar, Georgetown, Harrington, Bethany Beach, and a second Middletown site, which has been the busiest to date. And then we're also discussing adding more sites in mid-December. So just keep that in mind if you want to do Walgreens testing. Make sure you get a reservation ahead of time. Want to transition a little and talk about our young adults. It's wonderful to have young adults, college students come back home, but as you've heard us talk about, this is the age group and where we see the most spread of COVID right now. Really grateful to a lot of our young adults, especially our college students who have gotten tested in the last week, but we want to make sure folks know that testing isn't a hall pass to do whatever you want to. And so it's really very important that even if you tested negative on one particular day, that you continue to act as though you might be positive and make sure you follow all the basic precautions of wearing a face covering if you're with anybody outside of what has been in your household for the last few months. So if you're coming home and you're going to be around your parents or your siblings, you should be wearing a face covering for a couple of weeks. And social distance. Make sure you also social distance from those at increased risk. And as much as you may want to give grandma or grandpa a hug, now is not the time. So make sure that you keep your distance. Please avoid going out and hanging out not social distanced, not wearing a mask with high school friends and others. Again, please be as careful as you possibly can, and also consider getting tested again about 5 days or so after your arrival home. For those who are identified as contacts, meaning if somebody becomes positive and you have been in contact with them and you need to quarantine, we do want to remind people that quarantine means you really are to stay home and stay away from others, even within your home, for 14 days, regardless of negative tests. So a lot of people are believing that if you're told you're a contact, you can just go get tested, and if it's a negative, you're good to go. But we know that you can become positive actually up to 14 days. Most people become positive by 10 days, but that's why that 14-day quarantine is there. So you can't just test out of quarantine right now. That could change, but there are exceptions. A limited exception is for critical infrastructure workers, like healthcare workers, to preserve the function of the workplace. So as long-term care facilities, hospitals, et cetera, are surging and are struggling with the workforce, they are able, with precautions in place, to have asymptomatic contacts come back to work. But this option should be used as a last resort only in limited circumstances, such as when the operations of a facility or inability to operate a facility could cause serious harm or danger to public health or safety. So it can't be used in a blanket way just to give people a hall pass. All right, let me shift gears to talk about vaccines. As the governor says, there is a light at the end of the tunnel, and we just need to be careful for a while longer. But Pfizer has submitted its emergency use authorization request to the FDA. There's 2 other vaccines that are close behind, one from Moderna and one from AstraZeneca. The Pfizer one and the Moderna one have already shown over 90% effectiveness with minimal serious side effects, minimal side effects. So sore arms, low-grade fever, nausea, and body aches, which are not uncommon with vaccines, are what has been seen so far. There is a committee, an FDA committee, that's going to meet December 10th and take a look at this Pfizer vaccine, possibly the Moderna vaccine as well. They may approve it that day, and it is possible then that it may arrive in Delaware between December 11th and 14th. So that's the soonest that we will get any vaccine. At this point, we're estimating that we may get around 8,000 doses of the Pfizer with the first weekly allocation, and maybe about 7,000 with the Moderna. We don't know this for sure, but the point there is it's going to be a small amount to start with. And so there are a couple committees. One that is a CDC committee called ACIP that has been now for months looking at, what's the best way to maximize the benefits and minimize any harm from these vaccine and prioritize who gets it first. We also have a state ethics group that also met yesterday, and there's clearly consensus in our group as well as ACIP that the first group that should be getting the vaccine are those frontline health care workers that are providing care for COVID patients. That could be in a long-term care facility, that could be in a hospital, and we're working on those fronts. And we will be ready for when this vaccine gets to us. But healthcare workers, not just doctors and nurses, but other individuals who work in healthcare setting and are in contact with COVID patients or possible COVID patients are on the front line for getting the vaccine. Those in first responders, especially EMS, who are providing healthcare services to possible or probable COVID patients are also at the top of the line there. So that is good that we're getting to this point where we have more information to help us with our planning. Our team had a call with CDC and HHS last week where they described DPH in Delaware as ahead of the curve in planning. We've also done and will continue to create new resources on our coronavirus webpage. So de.gov/COVID vaccine is the direct link where we now have a fact sheet for the public, materials for medical providers, including information in Spanish, and we will continue to be providing updates as we go forward with the vaccine campaign. So I just want to close again by reminding folks to please be safe over the holidays. We know that you miss family members. We know that you miss friends. But just remember that this virus doesn't care if we are tired. This virus wants to spread. And when we let our guard down, that's when this virus is going to spread. So please be careful. Please wear face coverings. Please socially distance from other people. Thank you. And back to you, Governor.
Yeah, thanks a lot, Dr. Rattay. Congratulations again on your recognition by the Medical Society, the President's Award. Thanks for the update on vaccine distribution, which will be a big area of focus once we receive the first batch in early December, it looks like now. Yesterday on the White House call, we were advised that those first vaccines will arrive 24 hours, within 24 hours of the approval by the FDA. So we need to be ready to hit the ground running. I know you are. You've got your team's been working on it for months now and ready for distribution. It is going to take months to get it out to a significant portion of the population. But we're ready to go with respect to that distribution. AJ, I think you should just stand up, take a bow, and maybe go back to your testing sites because you've just been doing an incredible job over the last really several months, but in particular the run up here to the Thanksgiving holiday is just tens of thousands of people getting tested on a day-to-day basis, believe it or not. We've eclipsed 10,000 a couple days and keep getting feedback from people saying how easy it was. Obviously, some folks had to wait in line longer maybe than they normally would have, but just a great performance by you and your team.
No, so thank you, sir. And there's a lot of people to thank to get us to where we are today. The curative staff, National Guard continues to be our a partner, helping us with a lot of logistics. Newcastle County, the DPH and DEMA staff as well. So, as the governor alluded to, we really wanted to come up with a strategy to make sure we were in a position to accept and turn around tests as quickly as possible going into the holiday week. So this really started a few weeks ago when the governors of the 7 states put out recommendations for college students prior to going home. So last week we worked with 3 universities to make sure there was on-campus testing at each facility. Those results were turned as quickly as possible. But as we know, it's a snapshot in time. That test is only good for that day. Then going into this week, we knew we were going to have a lot of people that, even though traveling may be down, there's still going to be the national urgency to go see your family members and loved ones. So we want to help people do that as smart as possible. So we plan for additional capacity in the community, not necessarily more sites because the logistical lift. So we had the same number of sites. We expanded hours and individuals working at those to really help us increase the throughput. We are going to take what we learned really yesterday and today and refine that and make sure we have even a better plan when it comes to the December holidays, probably from the 15th or so on. I think we've identified some locations that can't handle the throughput that we saw the last few days. So we want to find maybe a site that would be a little bit better, but still hit as many communities as we can. So continuing to try and improve as we go forward. Very impressive turnout from the public the last few days. Last week, I think I mentioned that we eclipsed 7,000 tests for one time, and this is just curative tests. So this is what we're using at the drive-throughs, the trailers, some of the long-term care facilities. Staff are still using these. Some of the schools are using these tests still. So 7,000 was just a wow moment last week, and then yesterday we blew it out of the water at 13,000, and before the press conference today we were above 6,000, and we have sites that are open till 8 o'clock tonight, so still another 4 hours.
So AJ, on a normal day, what would the number be, above that amount?
So I would, we are double what we were doing last week almost, and 2.5 times what we were doing 2 weeks ago when we were. If you remember I think it was late October, early November, we were stressing people. We had capacity at the sites. We didn't think we were getting enough people to get tested. We were hovering right around that 80,000 number, kind of saw the 100,000 months kind of peak off a little bit. So people responded, and now I think it's going in overdrive as we're going into the holidays as well. The negative, the only negative here is the response time to get tests back. So, Curative is working with us very closely to make sure the turnaround time is as quick as possible. They have couriers at the larger sites so for example, we were at some Del Tech campuses last night. At 8 o'clock, they have a courier there ready to take those tests from there right down to the lab in DC to get the quickest turnaround time as possible. We were about 20 hours last week, so 20 hours on average from the time the specimens collected to the time the results are released. This week, from about Friday on, we're closer to the 28 to 30-hour period of time. I'm expecting that to increase a little bit more, but hopefully we're going to keep that under the 48-hour period with all indications right now. Some people that took their test yesterday, I checked before you came down here, about 300 of them already have the results back. So it's just a constant turn that they're working with the lab, and they've really been a great partner and have been very receptive to us increasing our capacity. When we met with them back in May, we wanted to do about 2,000 to 3,000 tests a day. Then we moved to June and July, got that 80,000 number, wanted to increase it a little bit more. So when we dropped off 13,000 tests yesterday, they didn't kind of say no. They just said, hey, let's work with you to make sure we increase the logistics where we can. So definitely one of many success stories I think we've had throughout this. We ask for people's patience. There are lines. We don't want to turn people away. We will have to draw that line in the sand because we do have to get the tests to the lab. But be patient. Register when you can. We understand a lot of the sites are full. We still are going to accommodate walk-ups as much as possible. But we also have to make sure we get those tests to the lab. So Dr. Rattay talked about some of the testing changes that are coming up. I think Walgreens, we have seen a lot of traffic there. That's that Monday through Sunday type of event where you could go get tested. I think that appointment only thing is going to help us with that thanks to our partners at DelDOT and State Police and some other law enforcement agencies to help us with the traffic control last week or so. We have the new sites coming on next Tuesday right after the holiday. We're going to bring another curative trailer into the state that will be here as well, probably the first full week of December. So that'll be another location that we have access 5 to 6 times a week. At-home testing, we didn't talk about this last week because we had an influx of requests. We have been able to clear out the queue, get those out to people. We're still seeing several thousand a week. We will be pushing this again. We kind of increased our capacity with Vault as well. So again, we're asking people to get tested after Thanksgiving as well, right? Your test yesterday doesn't get you, the get out free card till you get the vaccine. So go on, order this today. You'll have it, maybe after the holiday, take it next week and get your status. So, a lot of different testing options out there. Check out the website, de.gov/get-tested. Updating that as much as possible. There will be sites that are full and you can't register for. We do know the busy time is about between 11:30 a.m. and about 3 p.m., but book it outside of that, maybe a 20, 30-minute wait. So with that, I wish everybody a very happy Thanksgiving. I just, quick anecdotal note here. Best friend down in Chicago is in the ICU right now with COVID, 44 years old. So be smart this Thanksgiving because he won't be seeing his kids Thursday.
Thank you very much, AJ. Thank you for your team. Really an impressive effort over the last really 3 months as we've ramped up over 100,000. Our goal was to get to 80,000 a month. I didn't think we were going to make that, but you've proven me wrong. Curative has really been incredible, as really easily to get through and drive through sites. Just amazing community outreach and support at the pop-up testing sites, getting communities across our state so everybody has access, and important messaging in terms of what you can make of a negative test. It's only a point in time. It does give you an indication of where you are at that point in time, but it doesn't, if you've been exposed, a couple of days before, may not show up, and so you just need to protect yourself and your people around you, more importantly, those that you love, those that are elderly, those that are at risk. I try to think of everything in the context of protecting my 89-year-old mother, as I said earlier, and when you think about it in that context, you're certainly going to be a lot more cautious. You're going to think more about others around you. You're going to wear that mask indoors. You're going to wear that mask when you're coming in contact with others, and certainly everybody should be wearing masks when they're out in public, whether in the crowd or not. So know your COVID-19 status. Download our COVID Alert DE app. We're starting to still increase the number of people who voluntarily download the app. It'll let you know whether you've come in contact with somebody who tests positive, someone else who has voluntarily agreed to be part of the app for 15 minutes or less, and so, or more, I should say. And so you should avail yourself of this. It's a good tool to use. It's not perfect, but the more people that we get to use it, the better off we'll be. Don't forget about flu season and getting your flu shot. We want to reduce the possibility, the potential for additional hospitalizations as we move into flu season and the winter, to make sure that we protect and preserve that hospital capacity. I'm going to ask if we can go back to the one slide that shows the hospital capacity going back to the spring, how quickly we went from where we are today, frankly, now to our peak in the spring of 337, and how dangerous that would be for us to do that now. So again, on April the 10th, we are at 181. Today, on November the 23rd, we are at 185. Back in the spring, when the spread was not as great as it is now. Now, we're doing a lot more testing now, so a little bit hard to compare. We went from 181 to 337 in a week, and then slowly declined to a low of 29. We're at 185 now, and next week, we don't want to end up at 337 and really tax that hospital capacity, putting hospitals in a difficult situation with respect to decisions they have to make in terms of doing testing, elective procedures, protecting critical care for those most vulnerable populations. So those are the facts. That's where we were back in April. That's where we are today. We know we can impact that. Some of it we can't because people are infected already. It's a lagging indicator. We've talked about that. But we need to make sure that we're pushing down the infections from here on out so we don't make more people vulnerable to being hospitalized. So with that, again, we have some pre-submitted questions. We have media in the room. Invite you to come and answer any questions that you have. Thank you for being here.
Thank you both. I know we spoke a lot about vaccines today, and you said that frontline healthcare workers will be the first to get it. But I'm curious, once we have more doses, a bigger supply in months from now, how do you envision an average person getting a vaccine? What will that process look like?
Great question. First of all, as far as the timing goes, I mean, I think we all wish it were tomorrow, but we're anticipating that we'll probably have adequate vaccine for general population around March or so. Between now and then, or between the time we first get doses until then, we have a priority list of populations that we want to go through. But once it's widely available, pharmacies are going to be, one of the best places for people to get their vaccine, just like they get their flu shot now. So that's a really popular place for most Delawareans to get their flu vaccine is pharmacies, which many are in supermarkets or big box stores, but they're in everybody's community. So pharmacies will be certainly a popular place. Primary care providers and healthcare providers throughout the state will also be vaccinating their patients like they always do. And we'll also have sites, vaccination clinics, if you will, some in our public health clinics, but also kind of like the big testing events now. We'll have some of those big vaccination clinics where we try to push through lots of people quickly so we can get as much vaccine as we can out there as quickly as possible.
One of the other things we touched on was contact tracing. You mentioned that it's slowed down a little bit. For a typical person, about how long is it between when they might have been exposed to when they're hearing from DPH right now? And what are some of those tactics you hope to implement to slow down that or shorten that time frame?
Yeah, thanks for the question. And I will say I have multiple conversations with my colleagues across the nation every week. And on Friday evening, this was the hot topic where I think every state is feeling, in the same position where we're all seeing increased cases. And so it's put a lot of strain on our case investigation and contact tracing system. For us, the highest priority is making contact or having conversations with our cases first, because we want to make sure that they're isolated and that they think about who their contacts are and let us know. And so we've continued to prioritize those interviews with our cases, and we have been able to keep up with those conversations with our cases. For the contacts, though, now we are seeing a delay with our contacts, and that could be as long as 7 to 10 days. We are implementing a few different strategies. One is hiring a significant increased number of contact tracers. 31 were hired last week. Another 50 are in the process of being hired. So that's important. We're looking at very quickly skipping parts of the interviews, so making the interviews a lot shorter, but also looking at technology to do less calls and more outreach and contact through texting and emails once we've been able to connect with somebody. So through all of those approaches, we think we're going to be able to catch up pretty quickly, but yeah, it's definitely put some strain on the system.
About how many contact tracers would that put you at? with the new additions?
I will have to get back to you. If I were to make a guess, I'd say we were around 150, so that would put us around, we're now around 180, and another 50 would be around 230, but I want to ask my team to confirm that.
Sure. And for the governor or for Dr. Rattay, you rely on those case investigations in making some of your decisions as a regard to restrictions, because you said that you're seeing spread happen in private gatherings and restaurants. If you don't get to those conversations, is that a concern for you? Because that has been what you based the most recent restrictions off of.
It is a concern. We need to see a flattening of the curve, to use the term, in order to kind of go back and gradually reopen. We'll think about that a little differently than we did in the spring, where we followed the advice of CDC and the White House Task Force. We expect we'll get further advice. Every state is in a similar situation, more states, frankly, I think, than we're in the situation back in April, early May. And so we'll assess whether or not the restrictions that we have imposed are working or not. What we're hearing from the contact tracers, we keep track of percent positive, we keep track of new positive cases on a day-to-day basis, and so we need to see improvements occurring, and always trying to balance the cost of restrictions with the return on that, right? Because we've got to strike a balance. I mentioned the call with the president-elect and the national governors. You know, that was a big focus with respect to financial support. We had significant federal financial support to help small businesses get through the last peak. Now we need additional resources to get through this surge.
With winter sports coming up for high schools, do you think they'll be able to happen safely, given that most of them are indoor activities? Is there any concern with them not being able to get through?
Yeah, I'll
their
turn this
seasons?
over to Dr. Rattay. I would just say I have big concerns about that, and it's mainly because we know that indoor activities are just so much riskier than outdoor activities.
Yeah, we are having discussions around this. You know, I will say with DIAA and the high school sports, I think it's gone very smoothly this fall, and I'm really impressed with how the schools have been able to handle really implementation of the guidance, and mask wearing for these athletes is nothing. They just have done it without any complaints and have done it well. But indoor sports, especially wrestling and basketball, are such close contact that you know, there's multiple risks there that we don't have with these outdoor sports right now. And so we are thinking about it, and we're trying to best understand the risks and how, if they go forward, how we can best mitigate the risks.
And I'd just like to comment on the problem, right? Because I agree with Dr. Rattay with respect to the fall sports, particularly the competition itself. The athletes have adjusted. Who hasn't adjusted is fans, spectators, and off-the-field activities. On-the-field activity it seems fine. I've been to a couple football games myself, but spectators, fans, activity along the bench, I've seen a lot of coaches that had to go make sure the players were separate, and it's the same outside of an athletic competition, right? In structured environments, in our schools, teachers and staff are in pretty good shape in schools. It's those environments outside of the schools, the coming and going, the informal thing in individuals' homes. That's why it's so concerning now as we move into the Thanksgiving holiday, where everybody's moving indoor for indoor celebrations, and we know the risk associated with that. And so we think, with respect to all our restrictions, are we creating unintended consequences when we push people into those informal social environments? But that'll be a big question as we look at winter sports.
And just my last question for you on contact tracing, going back to that, is there an estimated distance between the time that someone's infected and you get to their contacts or you investigate them for it to be an effective mitigation tool? Is there a point where it no longer really helps you to get to them when it's a week or 10 days after?
Yeah, absolutely. I mean, the incubation period is 14 days. So if somebody's been exposed on, one day and they haven't been contacted by 14 days, there's little value in contacting them at that point unless, any of their contacts might be symptomatic. Yeah, exactly. So, the sooner you can get to a case and the sooner you can get to a contact, the better.
Gotcha. Thank you both.
Thank you very much. Thanks for coming. We have some pre-submitted questions.
First question is from Laura Walter at Coastal Point. A number of holiday parades were approved before you tightened the rules on public gatherings a week ago. Is the health department going to reevaluate the permits that were issued, and could any be revoked or modified?
Yeah, so we are reviewing those plans that have been approved, and we have gone back and asked for modification. We haven't rescinded any at this point, but we do know Harrington, as an example, has canceled their parade. Another parade is really promoting people watching it through their streaming. And so for those who are thinking about these kinds of gatherings, even if they've already been approved, make sure you really ask yourself the questions, are you sure you can do this safely, where you are making sure everyone is wearing a face covering and socially distanced at all times.
Next question's from Tim Mastro at Delaware State News. What is the status of visitation, indoor and outdoor, at long-term care facilities, and will there be enough PPE for facilities in the winter as cases are on the rise?
Yeah, thank you. That's a great question. In fact, we just updated our long-term care visitation guidance this past week. We strongly recommend that if visitation does take place, and we know that it's important to people to spend time with their loved ones, but if visitation takes place, we strongly recommend outdoor visitation. It's just much safer. There are long-term care facilities that have indoor visitation, but it's only those facilities that haven't had any recent cases. And so if those facilities have recent cases, they are not doing indoor visitation. The other thing I'd like to add, just for people to be thinking about, we know that there are some folks who like to take their family members home with them for holiday gatherings, and we are very strongly recommending that they don't do that this year. There is a real risk for these long-term care residents if they get exposed. And the new guidance does require that individuals who leave the premises will need to quarantine for 14 days upon their return to long-term care. So again, we really promote outdoor visitation as the best way to spend time with your loved ones who are in long-term care settings. And as far as PPE, we know that a lot of these facilities over the last 6 months or so have been working to stock up on PPE. We haven't had a lot of recent requests for PPE from long-term care, which is an indicator to us that they feel like they're in pretty good shape right now.
Next question's from Tim Mastro at Delaware State News. More information is coming out on COVID-19 long haulers as seen on 60 Minutes and in the New York Times. What has the state seen so far regarding those who show symptoms post-COVID?
Yeah, so we do know of some individuals who have had longer-term complications of COVID, and I think that that's a real stark reminder for everyone that this isn't just like a flu or many other viruses that come and go, that we really don't know the long-term consequences. And it's really something to be concerned about, that there may be long-term effects on individuals. So that's another really important reason why we all need to do whatever we can to prevent ourselves from getting ill. I'll add one more point in there from a recent study that I saw, that it's young adults seem to be pretty susceptible to becoming long haulers. And so, again, that's a group that often, feels like this virus isn't going to impact them, but that is certainly an age group that's suffering from longer-term complications.
Next question is from Doug Rainey at Delaware Business Now. Did you consider more restrictive measures other than the 30% occupancy limit for restaurants, such as 10 p.m. closing or closing taverns early on Thanksgiving, which is one of the busiest nights of the year?
Yeah, we did. We know that the days before and after Thanksgiving are among the busiest, particularly at bars for the young adult crowd, students coming back from college, seeing and meeting old high school friends for a few beers and the like. And we did think about further restrictions, but again, concerned about unintended consequences and pushing people into social environments outside of a bar or restaurant in a private home with the same kind of activity, but without mask wearing and that type of thing. And also we're constantly looking at striking the right balance between closing sectors of the economy down and allowing activity that can be done and be done safely. It's a judgment call for sure. In answer to an earlier question, we talked about looking at whether or not the restrictions that are currently in place at 30% and the limitations at the bar are going to be effective. Other states around us have tighter restrictions. We'll take a look at that and see what works. And it really is a message to everyone, business owners and patrons, that you got to follow the rules and make sure you're careful so that you don't force our hand to force us to do things that are even tighter restrictions than currently in place. But yeah, we try to balance out the equities there and the costs associated with the benefits that you get from the further restrictions.
All right, we have time for 2 more questions. The next one's from Amy Cherry at WDEL. Last week, we broke a record for the most cases in a single day since the start of the pandemic. Yet we are not under a stay-at-home order. Is that because we do not have a second federal stimulus package?
Yeah, I mean, I've been saying for weeks now that with an additional surge that we expected might come in the fall, that the tools that we had to try to control the spread would be more limited. A complete shutdown obviously has really significant economic and cost consequences, yes. We did have, not originally, not when we moved into the shutdown, but later we had the federal support and the CARES Act funding, which was a big thing for small businesses. We have resources left that we just made available to bars and restaurants, those adversely affected by the new restrictions, and that should help a little bit as they try to weather this current storm. But it is, again, as I mentioned a minute ago, it's an exercise in trying to strike the right balance with respect to restrictions that are going to be effective, targeted restrictions to the activity that we're seeing is causing the spread, and the cost associated with that to the business owners whose business is restricted. So we'll continue to do that assessment. We'll continue to lobby for a second stimulus. I think it just makes sense, certainly makes sense to extend the period of time to spend the money that's already been appropriated, that's already in our state bank, if you will, a state banking account. And I know that the President-elect, the Vice President-elect support that, as they indicated with the conversation with the governors just earlier this week.
This is the last question. It's from Kyle Johnson at WBOC for AJ Schall. Many are getting tested for the virus who are visiting family for Thanksgiving. Will the influx of tests affect the time it takes to receive results?
Short answer is yes. So, when we doubled and almost, increased by 250% what we've done over the last few weeks, that time will be increasing. We still expect it to be under the 48-hour time frame, so that's why our two big events were Monday and Tuesday, giving the labs enough time, tonight and Wednesday to hopefully get as many of those cleared out. But across the country, we're seeing labs times increase just because of the increasing demand, but we continuously use that in our data as we decide where to test and how much to test.
So thank you very much, and thank you to the media who joined us in person and those who had pre-submitted questions. I want to just close out this press conference on the eve of Thanksgiving to express my appreciation and thanks for our COVID-19 team, Secretary Molly McGarrick, Dr. Walker before her, all the people, Dr. Rattay, your team at the Division of Public Health, AJ, your team at DEMA, our local law enforcement officers, our partners with Newcastle County in testing, our partners at the hospitals, the frontline workers and essential workers across our state have just come up huge over the last 9 months. We have fought COVID-19 hard. We've beat it earlier in the year. We squashed the curve in June and July and had really good numbers in the summer and through the summer months, and are experiencing now the surge that we expected as the weather got colder and people moved inside. We're approaching now a really critical inflection point as we go into the Thanksgiving and holiday season to make sure that we prevent the spread of the virus. We protect vulnerable populations. We protect our elderly parents and grandparents, and we do it by thinking of others, by wearing a face covering when we're in public and in private, frankly, by being careful in social settings, not letting our guard down. We see the light at the end of the tunnel. The cavalry's on its way with a vaccine, which we hope and expect to get just in a couple weeks, our first batch here in Delaware and across the country. And so if we just lean in one more time through this weekend and through the days and weeks ahead, we're going to beat this thing and get through it. And so I want to thank every Delawarean for doing their part. We know in survey data that nearly 3/4 of Delawareans wear masks in person, in public and in private, follow the restrictions, and that's one of the reasons that we've had a better situation here than in other states. So thank God for your family and friends and for being citizens of the great state of Delaware, and have a good weekend.